Celine Dorado, you must have recognized me from the previous videos, and well, enhancing the natural features of your face is Doc Contessa's expertise, and that is well taken care of now that I'm coming back at CSA for another touch-up procedure. This is, I guess, my third time on the procedure of the nose, and well, since this is not just about vanity anymore, nowadays it is imperative to competitive fields career-wise. And it's Doc Contessa's goal not to alter the beauty that I already possess, but rather, preserve it and enhance it through her professional skills in dermatology, which is very much something that I really look up to. So stay tuned, watch till the end of this video so you guys will know what I'm talking about. And of course, don't forget to like the video, subscribe down below, and hit that notification bell so you guys are always posted and in the know about the non-surgical procedures like this.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have combination treatments for the non-surgical nose lifting, lip enhancement, as well as the so-called decontour via targeting the masseter muscle. And we'll do that for Miss Casey. Let's all welcome back Casey.
Hi everyone.
Yeah. Welcome back, Casey. So about 5 months ago, right?
Yes.
We did the non-surgical nose enhancement, and we were discussing about the semi-permanent effect of those nose PDO threads. And I was looking at Casey. Up to now, I can still see that good nose contour, that good projection of the nose. So far, Casey, how was it?
Actually, Doc, like what you've mentioned po, still very much prominent considering the fact that I'm a field reporter po, so I go outside, sun, the heat and everything, and it's still very prominent on cam po. So that's something that I really appreciate po, sobra.
Yay! So I'm also looking at Casey, okay, the profile view, the side view, okay, checking on the nose projection, the radix height, okay. So it's still within that right nasofrontal angle. And then also the nasolabial angle, I could say it's still within the 90 degrees to 100 degrees. What we want to still do right now is kind of boost what we have done before. Because when you place those PDO threads in this layer of those nose tissues inside, okay, so what's happening is the tissue build up. And you can already boost it. Actually, the earliest you can do your boosting is like 3 months, okay? You want to place again another layer of this PDO threads to help further regenerate. And we were saying it's like giving it a semi-permanent result, right? So for some individuals who are not into surgical procedures, this is an alternative for them. And what I also want to do for Casey is the tip projection. So what I will add today is the so-called narrowing of the alars, okay? There should be a certain width it should be within the so-called intercanthal width. So, today, that's something new for you. The so-called alar narrowing, plus again, the tip projection. And we'll be doing balancing of the lips, okay? And the maintenance of this jawline here, the angle of the jaw. So, for women, again, we wanted the lower third to be narrower, okay? What do you think, Casey? Exciting?
Super.
Yeah.
I'm super excited and super happy, especially because I know that this is the safest way, Doc.
Yep.
And of course,
Non-surgical.
with your technical skills, Doc, I think na anything that is, lasting and prominent, you can definitely do anything when it comes
thank
to
you for
things
trusting
like
us,
this.
okay?
Folks.
So, she's still young, okay? So, we're doing enhancement on her, okay? It's she's already beautiful, and for young ones, it's more of the enhancement. Okay, so what kind of treatment, what procedures, we'll show you when CSA Medical Aesthetics return. And we're back. So we're doing a treatment for Casey, the non-surgical method for our non-surgical nose enhancement, and also we want to do alar narrowing, and after that we'll do lip enhancement minimal, and also of course the maintenance for Casey, this part here, the masseter reduction part. Okay, Casey, so for the review of anatomy, okay, for the doctors there, okay, of course when you check on the dorsum of the nose, you wanna measure the nasofrontal angle, and here the inferior part you want to measure the nasolabial angle. Okay, so we follow the angles there. Then also the alar width, it should be within the intercanthal width. So just a minimal narrowing for Casey, not that much. Okay, she has already a good nose, so this is just like a maintenance for her. And of course, we still want to maintain that aligned nose, and at the same time that tip projection, and again the alar narrowing there. Okay, so for any procedures that we do, we cleanse the area, we apply topical numbing cream, and also we need to do some lidocaine injection. Okay, so a bit of a lidocaine injection for now. So the entry point is in the infra tip as always, and then after that we create the tiny opening for our PDO threads. So I have a gauge 19 needle here, and then make a tiny prick there. Okay, Casey? Okay, tiny prick there. And then we'll be using our PDO thread gauge 21 with a length of like 60mm length there. And we're gonna glide it here, okay, pulling up. And expect some tissue resistance already because we had done procedures for Casey in the past. Okay, I'm just gonna be very gentle in inserting this PDO thread. Okay, so just a gentle approach. So there's actually already tissue buildup from the one we did last time, so expect tissue resistance. So that's the first one. Okay, I'm just gliding gently and slowly. Okay, rotate a bit, and we'll do another one. So again, placement of these tissue materials is very significant. You should place it in the right anatomical layer. And material we're using is PDO. These are biocompatible, biodegradable material. And they have the so-called tissue collagenesis effect, neovascularization effect, release of like growth factor peptides for the tissue regeneration. Actually, this is already used for anti-aging treatments, okay? Those who wanted to maintain the good structure and also prevent the wrinkles in that dorsum of the nose. Okay, so we've done the bridge part. So again, we were able to restore that good contour. Okay, so for the tip, usually I make now a second entry point for the main reason I wanted to really place my PDO thread in that intercrural space, and for cases that are where the columella is a bit shorter. Okay, so we are Asians, Casey, so we have petite nose, so shorter columella length here. So some cases they have longer columella, I use the same entry point, but for those with shorter columella, I use a second entry point. Okay, there you go. So we'll be using a short PDO thread for this part here, this one. Okay, so for my entry point here, I'll be using only 2 short PDO threads. I'll pinch columella again. So we know that cases columella is a bit thinner or narrower. Okay, so we wanted to use a material here that will still be kind of like thinner also, and we're gliding it in the intercrural space. Okay, so we'll place a second one, and then after this I'll still do a so-called Alar bunching using my spiral cog 60mm. So for that part there, ideally you numb the Alar groove section here. So injecting our lidocaine there to numb the area, and then another lidocaine here to numb the area. So we're doing the so-called Alar bunching. So we'll make an entry point on the right Alar groove here, okay, and then another entry point on the opposite side in a little while. So apply the we'll cut the remaining threads, extruded threads, the floating threads, and we'll just cut this part here, and then we'll just proceed with our lip enhancement. The technique right now will be the so-called lollipop technique, okay, from the upper area here towards the body of the lip. Okay, we're pushing a filler. I'm using the Restylane Kiss. So you're entering from the vermilion border towards the vermilion body there, and a second one here. Just a simple technique because she has already good lips. It's more of the balancing techniques, okay, as well as here. So tiny aliquots of your filler material, tiny aliquot. There you go. So-called lollipop technique. Okay. Then we'll do the lower lip right now. So in the lower lip section, I do apply at the center this applicator stick, and then inject into this lower tubercle here this volume of your filler, and on the opposite side inject there. A simple technique like this to enhance also the lip tubercle. And then corner, you can improve this line here, and on the periphery improve the vermilion border. Simple technique like this. And on this near the oral commissure, a little bit enhancement there. And the opposite side, we're almost done with the lips. Let's do the Masseter botulinum toxin injection. So this will also improve hydration of the lips because hyaluronic attracts water. It will restore that plumpness, the natural contour volume of our lips. Okay, so let's do the Masseteric injection. Let's have our botulinum toxin. So bite please. Okay, so I'll use like first injection 10 units, and the second injection another 10 units. So ideally we make our markings for this one. Okay, so you start doing your lines, the superior line from the corner of the mouth to your tragus, and then the anterior line will be your masseteric anterior border. Then inferior line will be your jawline or the mandibular line, and posterior this part here. So, as to the technique, I use the 3-point injection technique. Okay, bite please. So you have to avoid the attachment of the risorius muscle at the anterior border of your masseter, because that one is helping with the smiling of the perioral region. So you want to avoid the problem of asymmetry for smiling. And so we've done the non-surgical nose enhancement, lip enhancement, the masseter injection with botulinum toxin. We'll show the result to Casey when CSA Medical Aesthetics return. And we're back, so we'll show the result to Casey. Casey, here's the mirror. So again, as a summary, we've done the nose enhancement, the dorsum, the tip projection, alar narrowing with our spiral curved threads, and that lollipop technique for the lip enhancement, and also the masseter injection using our botulinum toxin. So Casey, how are you so far?
I'm impressed, Doc,
Yeah.
to be honest. And like the pain is very much tolerable.
Tolerable.
And at the same time, at my age, which is like 21, I'm really young, I'm so scared to go under a scalpel.
Yep.
So I think that this is actually the way for me that will work.
Correct. Yeah. So it's just more of the enhancement. You highlight the beautiful features of your face, okay? And of course, it should be within the proportions, within right angles, okay? Within the proper rotation of the, like for example, the tip of the nose, the proper upward rotation there, and also the upper lip region. If you can see, like we did a bunching there, okay? So the cutaneous part of the upper lip, the length there, so far so good, okay? Because you know, when you want to look younger, you wanted that cutaneous lip area to be not so long. You wanted it shorter, and we were able to do also the lip treatment. That's why it helped in also making that length within the right proportions. Okay.
Like what I've said earlier, Doc, what you do best and what this does best is to actually not alter what you already possess, like the beauty of your features, but rather enhance it.
Enhance.
Because that's the most important thing. Like you also get to appreciate what you naturally have, and you also just get to enhance it, so you get to have the boost, confidence boost, which is, like what I've said, very essential to the competitive fields career-wise.
Correct. Very well said. Very eloquent. Okay, we're learning from Casey here, okay? So it's still the natural appearance, okay? It's still Casey, okay? And the thing is also, it's for prevention of the aging. Actually, according to studies, when you start to reach the age 25 years old, there's a beginning already, like collagen reduction already. So when you're doing non-surgical methods, you're preventing, delaying the aging process. And you're just helping your tissue layers to be strengthened. You boost them, okay? And of course, just within the right proportions. Beauty is symmetrical. Beauty is within proportions. Okay? Not doing so much of a thing on your face. The others like are doing a treatment on the nose, whereby the nose is so much more dominant, more prominent than the rest of the face. Okay, or the others are doing so much of the lips. Sometimes it's becoming so much already. So you just want to make it still natural and balanced with the entire face. Thank you, Casey.
Thank you so much.
Yeah.
And grabe the results po. I
Yeah,
really
natural.
love the results.
And of course, there will be some recovery for this. Like the others are like having soft tissue swelling for a few days only to a week. Okay, we just advise them avoid strenuous activities for the meantime, and we give some like prophylaxis medications for them. Okay, and we'll still see Casey again. Okay, salamat Casey as always for trusting
Thank you
us.
po.
Okay,
Thank you
she
so much.
already had other videos with us. We had other topics before. Remember?
Yes,
So,
a lot po.
So nose third already. We were doing also contouring, lip enhancement, chin enhancement, even eye area, right? The
Yes,
rejuvenation in the eye area. Okay, so thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.com, Instagram, CSA Medical Aesthetics, Facebook, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. You can leave a comment with this video and we can actually address your concerns or questions. Okay. So, God bless.
Thank you so much
Casey,
po. Thank you po.
And if you want to watch the other videos of Casey, just look at our YouTube channel, Contessa Salvador. Please click the like and also subscribe. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.